Everyone, my name is Sophia. I am here today to talk to you about healthcare within the humanitarian sector. I speak from a nursing perspective. I'm an emergency nurse and also have worked in infectious diseases within the humanitarian sector. I've always had a desire and a drive to work within the humanitarian sector and have a passion for health equity, global and public health, infectious diseases and disaster management and operations. For me, the humanitarian sector was not just about working abroad, it was also about working in the UK, which has led me to volunteer both in the UK and abroad. But for the last 13 years, I've been volunteering with an emotional support charity, and this has led me to work in a prison within homeless shelters and have provided support for adults and children who are in distress and vulnerable. I've also volunteered overseas, as I said, in hospitals. I have been on an educational trip to look at different hospitals within different countries, mainly within Africa. In 2012, I qualified as a nurse, and after this time, I have furthered my career within the emergency sector mainly, but also infectious and tropical diseases. I have also advanced my clinical skills, so I've undertaken courses such as advanced life support, advanced trauma nursing, advanced burns management, and I've also undertaken my tropical nursing diploma at the Liverpool School of Tropical Medicine. I've also done courses in health and complex humanitarian emergencies and emergency obstetrics and limited resource settings, and then most recently I have just finished my Masters in International Disaster Management at the Humanitarian Conflict Response Institute. Within my clinical roles as a nurse, I have, as I said, specialised as an emergency nurse and trauma nursing and also infectious diseases. I've held both clinical and managerial roles, leadership roles in the UK and abroad. I've also held roles in capacity building, training, mentoring and leadership management, as I said. Within my career in the humanitarian sector, I've clinically practiced as an emergency nurse in a refugee camp in Greece, which was voluntary. And I joined the UK emergency medical team roster in 2017. Since then, I've deployed overseas to sudden onset disasters, which happen to all have been outbreaks. I deployed to Samoa to the measles outbreak in 2019 under the UK emergency medical team. I have also deployed as an outbreak, I've joined the outbreak response specialist team under the UK emergency medical team and have most recently deployed for a COVID response to Lebanon with the UK emergency medical team, where I held the role of infection prevention control advisor and flow advisor for the UK emergency medical team. Each deployment that I have undertaken, my role has been varied and each role has been very different. My daily activities change vastly depending on what role I hold, whether it's from clinically practicing as a nurse in an emergency setting, as an emergency nurse or an outbreak nurse with paediatrics, with adults, to supporting hospitals, to supporting national colleagues in the work that they're doing already, and training staff, whether it's supporting the hospitals, colleagues, health systems, to develop their own capacity in the activities that they're doing to improve outcomes and reduce morbidity and mortality within their patients. providing clinical training, and also my most recent role, I've been involved in designing and assisting with the implementation of floor plans within the hospital departments to maximise the infection prevention control and the flow of the patients within the hospitals. All of this involves collaboration, and that in itself is challenging. You are required to collaborate within a team that you've not met before, and also with your host staff. So that involves also navigating cultural sensitivities, political sensitivities, and understanding the complete holistic environment and the approach to implementing any change or training. My day-to-day life, again, as I said, involves in building those relationships, positive relationships, meetings, training, and also clinical practice. Each deployment is different, and I think that's the main thing to say about humanitarianism. Working in the sector varies, and you can develop your role in whichever avenue you want to. In 2018, I undertook my Masters in International Disaster Management at HCRI. This really provided me an extensive theoretical understanding of the intricacies that were required to work effectively in the humanitarian field. The Masters really expanded, my knowledge in disaster preparedness, management, response, humanitarian and legal policies, procedures, disaster governance, human rights in world politics in general, humanitarian protection and psychosocial well-being in humanitarianism. That's for both the people you're caring for or supporting, but also you and your staff and your colleagues. The course provided me with so much more. It allowed me to develop my knowledge to not only go into a humanitarian setting as a nurse, but also understanding the small nuances that each individual area that you go in has and how to navigate those. And really, really going into a role and tailoring it for those people's needs and what the role requires of you. Sorry, I've just lost my chain of thought. Yeah, the course in itself, the Masters, was so important. And actually I gained far more than I would anticipate from doing the Masters, and I can really see the growth in my practice since undertaking it. Working as a nurse and a health advisor in the humanitarian sector can be emotionally and physically challenging and requires one to work in often very challenging, rapidly changing, sometimes unsafe conditions. This requires one to be really flexible, patient, and to have the ability to task shift, muck in, and be part of a team. And also you need to have the ability to adapt, collaborate, and often you're working with people that you've not met before, whether it's the team that you've deployed with or the team that you're working with in country. This isn't easy to do, and all of that you need to do whilst maintaining a high standard of care as you would in the UK, and also practice and understand cultural sensitivities. The greatest challenge for me working in the humanitarian sector is the physical distance from friends, family, loved ones. When you're working in places, there's often poor internet connection and different time zones, which obviously make it difficult to communicate with your normal support network, and can be quite isolating. However, said that, working in the humanitarian sector is challenging. However, it's the best decision I ever made. It's one that I've always wanted to pursue, and that hasn't changed. You meet incredible, like-minded, passionate individuals who share the same goals as you do, wanting to help and develop health systems and build capacity. I think that is the thing that keeps driving me forward. My greatest advice to anyone that wants to pursue a career in the humanitarian sector is have a realistic expectation. It's not all exciting. It's difficult, challenging, tiring, emotionally and physically. However, saying that, it's the best thing, as I said earlier, that I've ever done. My advice to you would be, if you really want to pursue this career, be patient. It's not easy getting into the field, and takes a lot of hard work to build up experience, both clinically and in the humanitarian sector. So my advice would be, keep volunteering as much as you can. Number 2, remember that everyone is a learning experience. Every person that you meet is a learning experience. Open your eyes to learning. Build good relationships with those that you meet, and really harness those relationships, allow those relationships to grow and nurture them, and say yes to every opportunity that's offered to you, I think is the biggest thing that I've learnt. Say yes. And finally, just most of all, your mental health is the most important, so look after yourself. Learn simple tools that you can use when you're deployed abroad, and you can use anywhere to look after yourself and self-care anywhere in the world. Thank you. Good luck in your career.